What is meningitis? Meningitis is inflammation of meninges including dura and subarachnoid and pia mater. When will you suspect meningitis? When someone with fever presents with severe neck pain and altered mental status, then you have to suspect meningitis. They may have associated vomiting and headache, photophobia, the aversion to light, that may signify the features of meningitis. Then you have to elicit the signs for meningeal irritation. That's called Kernick's and Brudensky sign. Please remember that absence of these signs will never rule out the diagnosis of meningitis. Then how will you confirm meningitis? Meningitis should be confirmed with CSF analysis, which is considered as gold standard. But before you go for CSF analysis, when patient has features of intracranial tension, like including bradycardia and severe hypertension, probably patient can be subjected to MRI brain with contrast first before patient undergoes CSF analysis. What is the advantage of MRI with contrast? Rather than taking MRI brain, if you give contrast, that will enhance meninges. The enhancement of meninges always implies that meningeal inflammation. So first most important is the MRI brain with contrast will tell us whether we are dealing with meningitis or not. And second one, it may point out presence of SOL or diffuse cerebral edema, which may force us to deter lumbar puncture. So once you perform lumbar puncture, if it shows normal sugar level, only increased protein, probably it may point out viral in origin. With respect to count, if counts are increased, if any WBC cells are present, that should be taken as the diagnosis of meningitis. Among the cells, if neutrophils are predominant, think of bacterial meningitis. If lymphocytes are predominant, probably viral or tuberculosis. Then based upon the duration of the symptoms, then probably you can take it call for tuberculosis. Then instead of sending CSF for each and every microorganism, nowadays something called BioFire encephalitis panel is available. In this test, BioFire test, what they will do? So they will analyze CSF with PCR studies, which detects nucleic acids from various organisms. Almost 14 organisms this test will try to isolate. So rather than trying to detect separate organism, probably the CSF can be sent for this BioFire encephalitis panel. So what is the treatment for meningitis? The most important empirical regimen for meningitis in adult is ceftriaxone and vancomycin. Ceftriaxone 2 gram IV BD and vancomycin 1 gram IV BD would be much helpful. So it is very useful in adult. So young adult means between the age of 7 to 50 years, then this empirical regimen would be very, very useful. But if patient is more than 50 years, we always suspect Listeria monocytogenes. These young adults, the most important organisms are Streptococcus pneumonia and Neisseria meningitidis, which can be covered with this ceftriaxone and vancomycin combination. But if age group is more than 50 years, then Listeria may be one possibility. To counteract Listeria, you are supposed to give injection ampicillin 2 gram IV 4th hourly. In all kind of meningitis, please remember that you have to give steroids, preferably dexamethasone 8 mg IV BD, to prevent meningeal adhesion to counteract the formation of hydrocephalus. So what is the take-home message? Anyone who presents with fever, if they complain additional symptoms of severe neck pain with altered mental status, please think of meningoencephalitis. These patients should be subjected to MRI brain and CSF analysis very immediately to prevent morbidity and mortality from meningitis. Thank you.